Are you thinking about cataract surgery and wondering how to pick an eye surgeon? I'll be sharing some of my potentially controversial tips and what I would tell my friends or family members if they were shopping for an eye surgeon. Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist and cataract surgeon. An ophthalmologist is an eye surgeon who went to medical school, completed a medical degree, and is a medical doctor. All ophthalmologists who completed an accredited ophthalmology residency have gone through rigorous training for at least 3 years and have graduated from their programs with at least a certain minimum number of cataract surgeries. Some will even go on to do a fellowship where they increase their skill sets, for example, a cornea fellowship or an anterior segment fellowship where they can specialize in complex cataract, cornea, or anterior segment surgeries. At the end of the day, any board-certified ophthalmologist will have the credentials and the skill set to do the best possible job for your cataract surgery. If you are lucky enough to have choices when it comes to picking an eye surgeon and find yourself confused on who you should select, here are some tips on how to find the right fit for you. There are several different practice models for eye surgeons, and my first recommendation is to figure out which one is the best fit for you. The traditional practice model is that you have an ophthalmologist who is your primary eye doctor and performs your yearly eye examinations, pretty much leading up to the diagnosis of cataracts, and then become the surgeons who perform your cataract surgery. This same ophthalmologist will guide you through your cataract consultation, your preoperative visits, then all your postoperative visits, and your aftercare. If you enjoy having that longitudinal relationship with your eye surgeon, this can be a great practice model to look for. But more and more practices are moving away from that traditional model and are co-managing with optometrists. Optometrists are doctors of optometry who have completed at least 4 years of optometry school and are well equipped to manage eye conditions as well as post-operative care following cataract surgery. Within co-management, there are several types of models. One such model is when a co-managing optometrist is your eye doctor and has followed your eyes for years. They've done your annual eye exams and know everything there is to know about your eyes and your eye history. They were the ones who diagnosed your cataract and work closely with a surgeon that they know and trust in the community. This optometrist will typically see you after your surgery for your postoperative care and follow-up examinations with a smooth handoff. The advantage of this model is that you will be managed by an optometrist who really knows your eyes and can help you make important decisions like which lens to put in during your cataract surgery and what category of lens might be the best fit based on your eye history. The other advantage is there is really less of a handoff in care, as the surgeon is primarily just doing the eye surgery, and a lot of the decisions and care is being done by an eye doctor who knows you. The downside of this type of model is that you won't really get a chance to know your surgeon and will most likely just see them on the day of your eye surgery. You will also have to trust the surgeon recommendation of your optometrist and may actually not have flexibility in choosing the eye surgeon yourself. Another common co-management model is within a surgical practice. If you select a surgeon, they may have optometrists working for them, many who are experienced in pre- and postoperative cataract care and know the preferences of the surgeons that they work for. The advantage of this model is that you will have a team of experienced providers who can help you through your cataract journey and potentially follow you after cataract surgery. These co-managing optometrists usually work side by side in the same office as the surgeon in case there are any issues before or after surgery. A downside is, like the other co-management model, you will not have much face time with your surgeon before your surgery. If you have an optometrist you trust, you can ask them if they co-manage with a cataract surgeon in the area. If you want to establish long-term care with an ophthalmologist and you think you're going to need cataract surgery at some point, you can look for a practice that has a more traditional model when it comes to cataract consultation and care. If you are set on having a specific cataract surgeon, you may end up with a co-management team within their practice. The next important consideration is provider fit. Everyone has their own preferences when it comes to doctors, male or female, young or old, quiet and serious, or friendly and chatty. Unless you are at a practice that is pretty much entirely co-managed, personality fit can play a huge role in finding a surgeon that you feel comfortable communicating with, and communication is key. There is more to your relationship than just surgery. This is a person you will be trusting with your eyes and possibly general eye care for years to come. There are some red flags I would look out for example, a surgeon who does not want you to get a second opinion, someone who seems careless or flippant, or someone who doesn't take the time to answer questions about your surgery. My next tip is to find a doctor who has expertise related to your specific eye conditions. For example, do you have glaucoma and are considering a minimally invasive glaucoma surgery? You may want to have your cataract surgery done by a glaucoma specialist or a cataract surgeon who also performs these type of surgeries. Do you have a cornea disease like Fuchs corneal dystrophy? If so, you probably want to find a cornea specialist since they can not only do your cataract surgery, but follow you through in case you end up needing a second surgery for your cornea, and perhaps even offer a combination surgery to address both the cornea disease and the cataracts at the same time. Have you been told that you may have a complicated cataract surgery? You might want to find somebody who specializes in complex cataract surgery. My next tip is to make sure you find a surgeon who is in-network. Some insurance companies will only cover surgeries performed by in-network providers. If you have a choice, you will want to find a provider who is in-network. You can always call your insurance company or go online and search for this information. Having the surgery performed by an in-network provider versus an out-of-network provider may be the difference between a minimal copay and deductible or a cash pay of multiple thousands of dollars per eye. When you want the best restaurants, a lot of us will look to review sites like Yelp, Google, and TripAdvisor. When looking for the best eye surgeon, you may want to shy away from online reviews. Online ratings are probably not the best indicator of surgical skill or reputation of a surgeon. Rather, it correlates to how much the practice or the surgeon pays for marketing. In fact, some of the best surgeons and practices out there do not rely on marketing, but instead through word of mouth and reputation. If you are trying to figure out who is a reputable surgeon in your area, ask your primary care physician, your optometrist, who they would send their family members for eye surgery. Online reviews can be helpful to help get a feel for the practice and the surgeon, but I would urge you to not just use reviews to pick out your eye surgeon. Most of us have two eyes, and if you're lucky enough to live in a place where you have choices for your cataract surgeon, I hope these tips were somewhat helpful in sorting through some of your options. Do you disagree with any of my tips? Let me know in the comments down below, and let's have a discussion. Thanks for watching, and I'll see you in my next video.